Thank you, Mishra. Dr. Rakesh, Dr. Geetha ma'am and Dr. Samir sir, all three are from ISC. They have some of the connection. We both are the odd people. It's more of an alumni meet, I think, rather than a planning session. An important takeaway from the entire day, I was observing, how do I put a context to the next 50 years? Because the current 50 years that we have done, have we done anything good? What have we done good versus what have we, underachieved was something I was looking into. And a simple statement from a common man's perspective, what I could observe is, the air we breathe, the water we drink, the nutritive value in our foods, the food choices we have started making, and the way we dispense the waste, and the points we are becoming, all are leading to a synergistic damage. I think healthcare is a behavioral problem. I think we need to correct that first, and probably change it from our kindergarten itself. Till then, I don't think we are going to see or observe any major changes. So, what's your opinion, sir?
Simple answer, yes. Yes, I told you.
Why are we not doing it? What's stopping us?
Behavior is very hard to change. So, like you said, you have to start very early. And you try to change it later in life. It is very difficult. I still can't get over, in spite of my cholesterol levels, I still can't get over when I see a samosa, I go for it. So, changing behavior is a very big challenge, and it is probably the answer to solving a lot of healthcare problems for today's generation, and making sure the future generation also is in better health. And I think that's a bigger challenge than a lot of other technology and medical advances we talk of. I think the biggest impact probably can happen with behavior. I'm a strong believer in that. So I just echo your thoughts, nothing more to add.
Samir, anything we do has to be scalable. So this is the easiest way to scale things, right?
I tell you, in this session, we are talking 50 years.
Yes.
Can I ask how many of you are below 25 or below? Raise your hand. Oh, very good. Is there anybody below around 20, 21 and below?
Yes, I can.
Okay. 20 and below, I don't raise your hand. 20 and below,
Biological years.
chronological year. You will say biological year will be lower than the chronological year. Yeah. Chronological year? 20? 21? 21 is there? Okay. I'm asking you. Get up. You will be at 75, 50 years later. What do you want to see in healthcare? You have a mic. When he's the real customer.
Yes. You come up. Can somebody pass a mic to?
I think one more person is there now.
I don't know what to say other than inclusivity.
Mic.
Yeah.
Yeah, it's on. You can speak.
Okay, you shout. Come forward and take this mic and shout.
I don't have anything other to say.
You can others. You are the person. So he has said that we want 1 minute. Asking the question. So this is yours. You have the courage to come up and ask it. Thank you. So why I'm saying this, he has said for everyone, correct? He wants to get healthcare for everyone. 50 years now. And today we are discussing AI. So how will it be possible? It's for him.
I'll take it back.
Mine has given him.
I'll take it back.
That is different than you're giving him.
It's a respect for you.
No, I'm giving him. He will remember it. Rakesh Mishra knows that I do this very often. Okay, across CSL. So I'm only telling why. Thank you. You can go. So my vision is, how do we make it affordable to all through technology? So let's imagine, I won't go 50 years, I'll go 20 years. What do we have? We have a primary health center where the poorest person, rural comes, bonding is discussed. So there should be an AI agent who will be backed up by a smarter AI agent sitting at the health center, that is the district headquarters, backed up by a doctor who will be digitally connected. Because this country cannot afford to, for 1.6 billion people, 20 years later, we cannot have doctor for one doctor for 1,200. There's no way. We don't have medical institution, we cannot do it. So how will we do it? So therefore, we will need extensive use of AI agents created who will be your first primary contact. And this can be done by India. The second thing I see visualization, the world will collapse healthcare. United States, Europe, Canada, all are broken. Here is a chance for India to have create our data. See, Indian data, we are not so sensitive about confidentiality. If I have got something in the lumps here, all my friends will ask, have you done biopsy? If your biopsy is done, they'll ask, is it back again? We share data. So this is an advantage for us. So we can give all our data in the public domain. And therefore, first effort should be, like people like me cite, 10 million individual participating and donating data. I will have no problem to give my data. Right? CSIR 10,000 Phenome project, all my data is open. They can be using it. Right? Now, what is that by age? How does it matter? Right? So therefore, this is our advantage. Can we create a 10 million personalized data contribution to 100 million personalized data contribution? And that data we will deliver to the world, their solution. And that should be our challenge for next 10 years. The next 10 years, we should be able to create AI agents, which will be doctor assistants. And what did I mention? We should have first responders through smart ways of reaching to the people. Because if Swiggy can deliver, Zepto can deliver in 7 minutes, why can't I deliver in 7 minutes streptokinase? Right? We should be able to deliver in 7 minutes, save a heart attack. So this is the future. I'm sure the healthcare from home, I am very clear that ICUs will be built at home. Because you will have rubber mats, which will have all sensors, this will be done. I'm finishing whatever I want to tell you. We will become the actually hub of medical tourism. So we will have township, just like University Township of Pennsylvania and here and there. We will have health township, not health city like only Delhi, Vedanta, real health city, where you will have Japanese tourists coming, so there will be Japanese culture, buildings will be made Japanese way, food, restaurant Japanese way, and the hospital will treat Japanese patients. Hospitals will have associated housing because first 3 days, hospital makes maximum billing, 80% billing is done in 3 days, but bed gets occupied. So they will be having, like an Airbnb, they will be having a house attached to it, which will have all the digital support, and that's the future. So you will have a German township, you will have a Japanese township, we will add to Arab township, and that will be the future. So India should become the world's tourism center for medical. and these are the visions, I believe, there will be massive nutritional intake if you have to take care of TB and things like that. Because it is difficult to get out of infection. It will stay as an endemic, like COVID. So therefore, early detection of healthcare through all mobile applications. My point is that can we jump, today we can detect COVID cough, cold and cough, TB cough, mobile. So that I know I have to go to doctor. Basically, can we create detections all into a mobile phone? Or as watch, and which is everybody can have, cheap device. And that eventually is our first responder. And then that gets connected to the health center, and then it whole thing happens. So I think this is how I visualize the future.
Dr. Geetha, you've been a pathbreaker, in combining AI and blending it into preventive health for in women's care, especially the breast cancers. And you've been able to scale it. Can you tell us, what has been the secret and along with the challenges that you have faced towards scalability?
Sure, but let's stick to the 50 years part. I'm super energized with what Sir mentioned about the overall scheme of things and how health city becomes a health country and so on. But I will sort of give my answer around what you mentioned. Yes, I know we have developed a new method of detecting breast cancer using non-invasive technique and AI being the primary differentiator. So the wonderful thing that Dr. Brahmachari mentioned is about who are all under 2021. What was running in my mind is whatever any of us say here, I guess none of us are going to be around after 50 years to say whether it is right or wrong. So we can say whatever we want, right? So having said that, we will of course come from our own perspective and trying to sort of see into the future. Right. So the way I think about it, and the scalability answer I will give you, is basically there is measurement, like how do we figure out that there is something wrong with the body? And then, of course, the treatment. Let's say only two, and then the continuous sort of monitoring aspect of it. So basically, I think today it is always breakdown based going to the hospital. Only when there is a heart attack you go. We talked about it in earlier sessions as well about preventive care being very very low in terms of adoption. People talked about devices on basically even smartphones not being used for health, etc. So I think what we're going to have is continuous monitoring. There is a new term that's emerging called ambient sensing, right? It's not new. Pervasive computing was around when I was studying in IIT as well, but it's in a different way, which is healthcare sensing, not just with wearables, but around you. And so I talked about the bed having sensors, etc. Once you're in a hospital or even at home, etc. So sensing the different parameters of the body, wherever you are, and continuously. That is something that's going to happen, which means that we're able to do early detection in a pure sense, earliest detection if possible. Of course, AI has to be there. If you ask me, I've just been breathing AI for 30 years, so I will say AI will remain forever, but in a different way. We will not be fighting with AI replace doctors, or like we say today, like doctors using AI will replace doctors not using AI. I think it will become so mandatory that just like using a pen, they will use the different tools that are available for database analysis, because there is such humongous data available in a digitized form. It's really not possible to sort of make insights out of it. So from a monitoring standpoint, there's going to be continuous and sensing and so on. Treatment standpoint also, I think today we treat with medicines, etc. And of course, there is holistic aspect which is already going into it. But we have seen, probably I'm eating into Dr. Rakesh's thing about genetics part of it. We are talking about CRISPR, we are talking about, different kind of modification in the body, which is so personalized that for you, what is the treatment? And also we are seeing, as a cancer sort of enthusiast, I would say at this point in time, we see bots, there are early instances of bots which go into the body, figure out where is the cancer, and then open up the drug sufficient enough to cure at that area. So that would become, I think, more and more prolific as we move forward, where we are not treating as medicine alone, but we are treating with respect to changing different parts of our own body accordingly. And if, of course, there's a disability or a replacement needed, we were hearing about some work being done at Sense and other places where, of course, we do 3D printing for different ears and other places, but maybe even biological elements being printed, personalized for individuals will happen. So the way treatment happens, when the treatment happens, will also change in my opinion. And finally, completely, if possible, prevention, right? The name of my startup is Nirama. It stands for no diseases, right? So hopefully we will be so well that we don't let the disease come in at all, but we kind of, Sir was also talking about earliest sensing possible, right? If we can do it that way, then it's very difficult to prove prevention, and have you thought about it, right? Clinically, you cannot prove prevention, because if you really prevented, there's no evidence of prevention anyway. So hopefully people will live much longer. Then there will be other problems that come because people live more than 100 years, but let me pause.
And incidentally, Nirama ends with AI, so I don't know if it was purposeful.
Exactly.
Yeah. So, Dr. Rakesh, you've been a forerunner in both genomics and epigenetics as well. More into translational genomics, I would say. Whenever I needed some sort of data, I've always gone to either the UK Biobank or the all of us from the US. In India, there is something called the CSIR. We have been emphasizing since morning. CSIR Phenome India. I'm not sure if anybody in the audience know what it is. Anybody who knows? Surprising. So, could you throw a little bit light on this? After your opinion on healthcare for 50 years and what it should do now?
Sure, yeah. So, I can tell beforehand what you asked to Phenome India. It's my responsibility to advertise CSIR a little bit. I get pension from them. So, Phenome India is actually CSR employees, current or retired. They give their samples every year, and so 10,000 such individuals are followed. And in our lots of parameters are recorded, including muscle, breathing, heart checkups, liver tests, all those kind of things, and all across the country. And we are trying to correlate the actual health and these biochemical parameters. And as would be expected, lots of things we are getting very surprising. So maybe new baseline will be drawn for certain disease, and many things which we don't we are getting from there. And I hope that it will continue for many years, just in 2 years of his life. And I think it should continue for decades and maybe more. Yeah, I'm registered, and next month I'm going to give samples again. So it's fantastic. I discovered few things, and then you start taking precautions, and those things are useful. So that's a massive program that CSR has started. So that was about the question that he asked. And about the next 50 years, I think the information, the speed with which information is being generated, here largely I mean by genomic information, because our health is largely based on what we are. And we are also different because our genomes are different, and that's very fundamental. And this information is generated at very high speed and becoming cheaper and cheaper. I'm sure in a few years to come, all of you will have your genome sequenced and will be in a card with you. There is no question about it. It will be less than maybe 5,000 very soon. So, and the other thing what you heard about AI, the information being processed and utilized and cooked and boiled and spiced is happening with tremendous speed, computational analysis, and this is like a cascade of things, like it increases more and more. So these things, lots of misinformation will happen, many other things will happen, but these will also, there will be people who will be using it from the existing technology. This information is going to change the way healthcare is taken care of today. I'm going back to the technology that is going to transform tremendously. Young man just said that after 50 years we will need healthcare, which is affordable, which is personalized, which is so important. I don't know if you have thought about it, but that is what is the really the basis. In this country, we have to think of medicine which is available to everybody. Otherwise, it's not a medicine for this country. There's gene therapy, which is nobody can afford. Even rich people cannot afford. It costs 20 crores. Can we have a gene therapy for 2 lakhs? If that's done, and I can tell you that is possible, and that is what is going to happen. This is going to transform, which means the rest of the world will shut their shop, and as Professor Brahmachari said, they'll come here. Similarly, we have enzyme replacement therapy, which is for many related disorder, and the cost is anything 40-50 lakh to 1 crore per year, depending on the weight of the child. That will be made really, and you cannot afford from the pocket. How many parents can afford 50 lakh in a year? The government gives 50 lakh one time for related disorder, so that means it's not enough even for 1 year. And we cannot even afford the basic care for all the 90 million patients who are rare genetic disease patients. They have one class. So that means we have to find a new way of doing this. So enzyme replacement therapy will become available for not for now 50 lakhs or 1 crore. It will be available for 10,000 or 15,000. The new technology is coming. You don't have to make protein in the cell lines and refold them properly, transport them, all that. Just take the body mechanism. Body itself makes protein. What is missing is the gene. Provide the mRNA, it will make the protein. It will fold properly. PTM will be absolute as it is natural, and you will get the protein as it is required. And these are the things that are in cell culture. So you know the mRNA vaccines have been used. Billions of people have been given their safety established, and the cost of 1 dose for Moderna is $4. For India, it will be 40 cents. So, but the cost doesn't remain any more factor. So that is where the science is going to transform what we require. Surprisingly, the better policies, better regulatory system. Many times there were discussion by entrepreneurs or startups saying one of the reasons is the roadmap is not clear. They don't know what to do after some time. So we have to make proper runway so that our entrepreneurs or young companies can take off. Because that's the only way we are going to be. We are not going to be developed in this country because of Tatas and Reliance and Adanis. We will become developed country only when we have thousands and thousands of young companies and small businesses which become viable and profitable. So that's what is required, and that is what we have to now work on. And I'm sure in future, with so many young people, science there already, policies are getting in place. Government is making provision that the indigenization and technology platforms they have become available. And I'm aware that government working very hard on making rules and regulation and policies which are rationalized to the demand of the technology. So I hope things will improve.
I didn't answer the question about what to be 50 years ahead, so I want to take a stab at that. So, the one thing is that let's take the positive view first. And the positive view is that the median age of India is today around 28. 50 years later, the 28 years will be 78. The shift would have happened considerably to the other side of the spectrum in terms of demographics. What I hope is that all these longevity startups that have started recently are successful and tackle this problem sufficiently so that when this gentleman is 71, 50 years from now, he's playing football and he's kicking the ball and he's doing all kinds of things. Unlike probably me or some other 70-year-olds. I'm 58, but I think a lot of 70-year-olds still have knee replacements and all kinds of stuff. So I hope he doesn't have to do all that. The other thing is the advances, like we spoke about, the treatments and the genetics, and so much will improve on the keeping the body going, right? I'm wondering, what will we do about our minds? Because more and more, already you can see an AI knows so much about me that an agent who's my agentic AI can answer everything I say. It has already understood me well enough to take this panel and sit on my behalf and answer the questions. I don't know what it's going to be 50 years from now. 50 years from now, are our minds going to be any relevant at all? And what are we going to do with our lives? Like somebody just, I think Manjunath sort of hinted at that. And that problem is already beginning to show. If you ask anybody working in mental health, one of the biggest problems across all age groups today is loneliness. And unfortunately, technology, AI or anything, or even medical science is not helping in this aspect very well. So I would say very strongly, if you want 50 years later, like Dalai Lama was today 90 years turning on July 5th, I hope we can have people as healthy as him at 90, as happy as him at 90, and still giving talks and still being, fairly mobile and being good for everyone. So I think happiness is another thing that one will have to work really hard for the next 50 years. Yeah. Thank you.
I just asked ChatGPT, how will be healthcare 50 years from now? You know what the answer I got? There will be a paradigm shift. I'm just shortcutting. Hyper-personalized medicine, genome-first care, digital twins, AI-driven diagnosis and treatment, AI as your doctor, real-time monitoring, brain-machine interaction, neurotechnology, regenerative and longevity medicine, organ regeneration, cellular rejuvenation, longevity drugs, remote and decentralized care, hospital at home, smart toilet and mirrors. Okay, because smart toilet can tell you prostate very easily. Global equitable access, human living longer, healthier lives, 100 plus will be common health span. Ethics will be crucial. Who owns your data and DNA? So you see, all of us are redundant. You understand? This is the world we have entered in. And I can tell you one day, I was asked to inaugurate or launch a product which is terahertz technology for breast cancer detection. I knew very little. But I had to launch because it was my grad student, a startup. I asked AI. 45 minutes, I became expert on. And after half an hour, I gave the online launch. After that, my student and grad student said, "What a speech, sir, what a speech." You understand? So asking the right question, that's all you have to learn. And understanding what it says and asking another right question is that all matters. And this will all happen.
So you mentioned about who owns the DNA.
Yes.
So we would like to answer that.
As an individual, you own your DNA. And
You are part of the chat.
That's true for today because it is.
let me tell you that, although we think we own our DNA, if I set up a machine here, I can collect everybody's. We are shedding cells every minute, and we have millions and millions of cells. When you suck everything, put a thing, I can put in a machine and do metagenomics and it sequence all of it. So this technology is going to come. So it's your DNA, but after it goes to environment, I can collect from the wastewater of Bangalore and sequence entire city. So it will happen. So that it's question as long as in your body it's your DNA. After it is the nature.
Your part of the body is not tradable. So you can own your DNA. I can take your DNA, but cannot be traded. It's a part of the body. But associated information is intellectual property protectable. So your DNA along with that data is an intellectual property. Now who owns it? As per copyright law, whoever captures it owns it. So that's why hospital says I own the data. But it is the consent of the owner who has given you to hold the data. You understand? So the copyright actually has a patience as a right, but It is held by the person who has captured. Like my talk, he has captured. I have lost a copyright. It has gone to his copyright because I did not give a consent in advance that whatever I talk is my copyright. You cannot use it yourself. You follow? And that's how the DNA is still a dilemma about with respect to ethics. Who will hold the data and the DNA? Data and the DNA together only make knowledge. Not one or the other. You can have your DNA but no data, then have nothing.
I'm going to take a little philosophical question here that are we our DNA? Are we our bodies? Or are we something beyond that? Maybe 50 years from now, or before that, we'll discover that we are actually forms of energy. Yeah. So maybe that will give us a totally different view of what we are.
I have a similar philosophical view. Rather, it was from your deliberation around mental health and happiness. I think after 50 years, we'll not call it health care, we'll call it happiness care, I guess. Let's see.
So just to, on a closing note, just a round of applause. The final ending note is, from an India perspective, I think India has graduated as the fourth economic superpower, and we all should be proud of that. We should either remain there or at least move ahead. So to do that, a new metric is coming up called as the HALE, Health Adjusted Life Years. So this is going to be an important metric in determining your economic power as well. So let's get our plates right and let's move India ahead. Thank you, guys.
Thank you.